Good evening. I'm Mayor Ron Nirenberg with County Commissioner Rebecca Clay Flores, and we're joined tonight by Dr. Junda Wu, our Public Health Authority here at San Antonio Metro Health, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 210 new cases of COVID-19, which brings our total to 203,191. Our 7-day rolling average now is 179. Sadly, we are reporting 3 new deaths this evening. We have lost a total of 3,076 of our neighbors, friends, and family members to COVID-19 this year. Please keep their families and survivors in your prayers tonight. Again, every single one of these numbers that we report each night is a loved one who is dearly missed and lost. Over in our hospitals, there are 188 COVID-19 patients tonight. There were 31 new admissions in the last 24 hours. 69 patients are in ICU, and 39 are on ventilators. As of yesterday, with the vaccine update in Bexar County, 434,611 people have received their first dose vaccine, and a full 243,317 are fully vaccinated with both doses. Again, let's continue to wear our masks and social distance as we work to get more vaccines in our community and more people vaccinated. Quickly, an update on the Alamo Dome appointments. 30,000 appointments will be released tonight at 7 p.m., and everyone currently eligible age 16 and up with underlying health conditions or age 50 and up can register appointments. Again, these 30,000 appointments that will be released at 7 p.m. today are those for those who are 50 and up or 16 with underlying health conditions. Beginning Monday, everyone ages 16 and older will be eligible for vaccination and can register at that time. Our goal is to vaccinate everyone eligible, but we will continue to prioritize vulnerable populations. If you don't have internet access, you can book your appointment by calling 311 or call the COVID hotline. The 311 hotline operating hours are Monday through Friday, 8 a.m. to 5 p.m., and Saturday and Sunday, 8 a.m. to 12 p.m. Remember that you can also subscribe to the vaccine alerts to let you know when appointments become available by texting vaccine or vacuna to 55000. Let me turn it now to Commissioner Clay Flores.
Thank you, Mayor. I'm County Commissioner Rebecca Clay Flores, and to date, Bexar County Hospital, UHS, has given a total of 236,581 vaccines, and yesterday alone gave 5,935. We have been working with our federal contacts to try to get Bexar County designated as a mass site, because if we receive a federal designation as a mass site, then we would be eligible to receive even more vaccines. Bexar County Hospital, UHS, at Crossroads Wonderland has the capacity to vaccinate 8,000 people daily. We already have a confirmed community sites in the hardest hit areas that we are waiting to open as soon as we start receiving more vaccines. UHS has already put in a request for the Johnson & Johnson vaccine, as that one is a one shot, which would enable us to fully vaccinate the community quicker. But we are still waiting for a response from the federal government on that. This week, the Commissioner's Court, in conjunction with Bexar County Hospital, UHS, has kicked off a marketing campaign to encourage our community to continue wearing masks until all of Bexar County is vaccinated. Just because adults of any age will be able to get vaccinated starting next week, children still are not able to get vaccinated. We need to make sure we are keeping children safe. So please choose to wear your mask. You can find our campaign videos on the county's social media under the handle @Bexar County. Thank you.
Thank you very much, Commissioner. Today we also want to highlight frequently asked questions that we're receiving here at Metro Health and throughout our community. So we're going to be asking one of these questions each time we're on the air, and the questions are those that Metro Health and 311 receive regularly. So our first question tonight is going to be posed to our very own Dr. Wu, and that is, Dr. Wu, can the COVID-19 vaccine give someone COVID-19?
Absolutely not. There is no live virus. There is no dead virus. There's a bit either fake spike protein or a recipe for fake spike protein. And spike protein is like a really distinctive hat that the virus wears, so that your body makes antibodies, and those are your warriors, so that if your body ever sees any virus wearing that hat again, it knows to attack. So I think the other thing that goes along with that is sometimes people say, well, then how come people sometimes have side effects? And you'll notice the side effects never include losing your sense of taste or smell. They never include being short of breath. So it's not COVID. Those side effects are your immune system revving up, and it's good. It means the vaccine is working.
All right, thank you very much, Dr. Wu. And we also want to remind you the city and the county are working together to provide relief for folks who need it during this pandemic. If you're struggling paying rent or mortgage, please access our emergency housing relief program. You can call 311 or go to covid19.sanantonio.gov. Also, if you're out of work without an income and would like to enroll in our training program, Training for Jobs are available today. While you receive a stipend to make ends meet, you can enroll at 210-224-HELP. And as always, you can get the latest on COVID-19 in our community by texting COSA-GOV to 55000 or by going to the website covid19.sanantonio.gov. Please continue to do your part. We are doing well. We're almost there. Let's work together to put an end to this pandemic. Please mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Commissioner Clay Flores, myself, and Dr. Wu are available for questions.
We understand that there's been a contract going back and forth between Bexar County and the Freeman Coliseum and the feds in regards to using the Freeman Coliseum to house unaccompanied minors. Do we know at what point it's being held up at right now? We understand it's not finalized yet.
No, but with any contract, they're negotiating back and forth. I spoke to the judge about it earlier today, and he said that they should have more details tomorrow.
We also heard from Sheriff Salazar, who's been very vocal, saying that he does not want his deputies to be pulled off the streets to provide security. How is security going to be handled if the sheriff is saying that he won't do it?
U.S. Department of Health and Human Services will be responsible for contracting security. That's something they'll be handling since it's going to be the federal government.
Do we have any details on how long the Freeman Coliseum might be used for at this time? Is that still being negotiated?
We know it's going to be a short-term contract.
If approved, would Metro Health have any role in the activities at the Freeman Coliseum?
Our role would be as far as quarantine or isolation or possibly vaccination.
Do you have any concerns about security at the Freeman? Commissioner Trish DeBerry made a point that the Freeman is not like a military base with extra layers of protection.
No, I don't have any concerns. Like I said earlier, it's a federal government Department of Health and Human Services, so my understanding is that Homeland Security will be taking care of security.
Esta sería en español, comisionada.
Sí.
¿Existe ya un acuerdo para que el Coliseo Freeman pueda recibir a los niños migrantes en este momento?
No, todavía no tenemos los detalles de eso, pero hoy en la mañana hablé con el juez y dijo que ojalá mañana ya van a tener más detalles.
Ahora, precisamente, y la pregunta ya se le hicieron, hoy el sheriff Javier Salazar dijo que no le gustaría a él participar en esto y que sus oficiales no los quiere haciendo trabajos en este operativo. ¿Cuál es el sentir de usted como comisionada? ¿Esperaba esta reacción del sheriff?
Pues prefiero no meter en mis opiniones personales, porque este contrato va a ser algo del gobierno federal. Entonces ellos van a estar responsables para tener la seguridad. De hecho, el Departamento de Homeland Security va a estar encargado de eso. Entonces no vamos a tener que poner más trabajo en la policía local.
¿Usted cree que el Coliseo, y tal vez usted ya dio un tour por las instalaciones, no sé, pero usted cree que el Coliseo Freeman es una buena instalación para tener a menores de edad por un tiempo limitado, temporal?
Sí, claro, tenemos que recordar, la verdad no le hace que son sus opiniones políticos, pero tenemos que recordar, estos son niños y son los niños de alguien, y como cualquier persona en la comunidad, tenemos la responsabilidad y derecho de cuidar a cualquier niño.
Dr. Wu, you mentioned possible vaccinations through Metro Health. Could, if the unaccompanied minors are 16 and up or eligible for the vaccine as of Monday, could they get vaccinated while they are here?
This is super hypothetical. I was really just talking about the role that a health department would have. So I think we're open to be brought into conversations about that. Definitely, the county is capable of doing vaccinations too, as you've just heard. I'm just saying those are the traditional roles that public health might play.
And yesterday, Commissioner Rodriguez did mention that the field hospital that has been set up at the Freeman Coliseum is going to be, moved or gone altogether. What is the contingency plan should the Freeman Coliseum be needed, overlapping when the unaccompanied migrant children are in San Antonio?
They're still working out the details of that, so I don't have a lot of information on that right now.
And then when it comes to who's paying for this, we understand that there's going to be a federal reimbursement, but do we have a timeline on where the money's initially coming from?
No, I don't have the information on that, but like you said, it's from the federal government, so there would not be an expense to local taxpayers.
Do you know how many children are expected to stay there?
We don't have the details of that. We know that it could hold up a capacity up to 2,400.
Catholic Charities says that FEMA is taking a look at the Nix Medical Center downtown as another potential location. Do any of you have any information you can share about that?
I do not, but I will say that we had a conversation with HHS this afternoon, and they indicated that the only facilities being vetted in our community were the Freeman Coliseum and then the facility at Joint Base San Antonio-Lackland.
Commissioner, would you be able to describe the living situation and the arrangements in the Coliseum?
I don't have information on that since it'll be a federal contract. Department of Health and Human Services would be the best people to answer that. Obviously, we would be concerned to make sure that they are sanitary and comfortable living conditions.
Mayor, regarding of the political implications that this issue always has, how do you feel? You're the mayor of this city. How do you feel about San Antonio hosting children, immigrants that are, they're for whatever the circumstances, they're ending up in this country, and one of their first steps is going to be the city of San Antonio?
Well, some things ought to transcend politics. We're talking about a human tragedy that's occurring on the border that we've seen before, time and again, actually, and the city has been put in the position of having to deal with the crisis and the relief from the border. What we saw in 2019 with the Migrant Resource Center was stood up very quickly to provide compassionate response. We lean on our faith community and nonprofits in our community to help with that. In this case, this is a federal operation. What we hope is that in dealing and responding to what is, again, a humanitarian crisis, that these children, again, because they're children, are treated with the utmost compassion and care.
Mayor Nirenberg, will the city allow people to camp out at Breckenridge Park this Easter weekend to reserve a spot for the holiday?
So we have not made that call yet, and we will do so next week. I will tell you this, we are almost out of this pandemic, and we are wanting to make sure that we have seen the last of it once we put it behind us. So I will say we will err on the side of caution. We have not made a decision of whether or not camping will be permitted in Breckenridge Park, but when we do make that decision, it will be made out of an abundance of caution with the current health guidance and conditions at the time, and we'll take a look at that next week.
How do you make sure that the people signing up for vaccine appointments tonight are eligible?
In the same way that we do already when they come. So part of it is the honor system, but also once people actually come for their appointment, at that time we're clearly able to vet them and see if they're eligible or not.
We got word today that all adults 80 years old and older can walk up to the Alamo Dome starting today and get a vaccine without having an appointment. Is this true?
I actually didn't see that come through. It's starting Monday for sure. And we're recommending that they come in the afternoon because the mornings are so hectic. But yes, people starting Monday for sure. And we'll have to get back to you on that. Maybe I missed something if it came through today.
Have we received it?
UHS, people, so with the county facility at Wonderland Mall, people 80 years or over, because starting next week, all adults are eligible, so we still want to prioritize people who are over 80 years old. So we don't want them to have to hassle. Of course, we're encouraging them to sign up on the website, but if they can't, if they show up, they can go to the front of the line.
Have we received an updated predictive model, and are models pointing to a decline or plateau or increase in cases?
I have not seen an updated model, and that model is best for when we're on the increase, which I hope doesn't happen again, but you never know. And then it can tell you sort of how fast you might go up or how long. But when you're going down, it's not as accurate.
Commissioner, one final question. Do we have a date potentially of arrival yet worked out for the unaccompanied migrant children for either Lackland or for Freeman Coliseum?
I have no knowledge on Lackland, obviously, because that's a military base, and since the contract still has not been finalized with the Coliseum, we don't have the details on that either.
Thank you. That's all we have tonight.